Hello, welcome to this video. My name is Dorcas. Breastfeeding is the best preferred way of feeding for a baby, and especially those who are below 6 months, that is from birth up to 6 months. It's recommended that breast milk is the only source of nutrition until they are 6 months, which is what we call exclusive breastfeeding, and continued breastfeeding up to when the child is 2 years of age, alongside complementary feeding. However, in some instances, you may find a mom is not able, or a baby is not able to achieve that exclusive breastfeeding or continued breastfeeding up to 2 years. So when that happens, then you look back and ask ourselves, what is the next best alternative so that we ensure that the baby is getting enough nutrition as required and adequate nutrition to facilitate the growth and development needs for the child. So in this case, then formula milk comes in as the next best alternative. So when you're looking at formula milk for a parent, a mom, a guardian, so sometimes you're a bit confused on which formula, because the formulas are many in the market. So on which formula is best or is ideal for the baby at this particular age or based on this particular medical condition. So in this video, I would like to address the various formulas that are available in the market. I will not go to the brand names. I'll just basically talk about the different classifications of formula and when it is recommended to use certain formulas. I would also want to mention that some of these formulas, in terms of prescription, it will be best you consult your healthcare provider, your doctor, your nutritionist, your dietitian, your pediatrician. A healthcare provider should be able to advise on the best formula to use. But we can discuss briefly on what are the options that are available. So when you're looking at class 1 is what we call the standard formula. In this standard formula, it is just the classification is basically one based on age. The nutrient composition may vary from one age to another based on the various nutrition requirements in the different ages. So stage 1, we are looking at formula milk that is meant for children who are 0 to 6 months. Okay. Stage 2, we are looking at babies who are between 6 months and 1 year of age. And stage 3, we are looking at babies who are at 1 year to 3 years of age. The stage 3 is also called the the following formula. So when you're looking at stage 1 to 3, these formulas are most ideal for babies who do not have any medical condition or do not have any issues surrounding digestion or absorption or tolerance. So a child who just needs who the milk is just needed for supplementing the breast milk without any underlying issue. So stage 1, 2, 3, based on the age, would be your best bet in terms of choosing for formula. So when you're looking at class 2, then you're having the hypoallergenic formulas, basically meaning hydrolyzed formulas that are best suited for various medical conditions or certain digestive or allergies responses from the baby. Then in this class, you would be able to choose based on what is it that you are addressing. And with this class, it will be best if you would consult the healthcare provider so that then you're able to choose the best formula based on what the child is experiencing. Because when you're looking at hypoallergenic, we have the partially hydrolyzed formula and we have the extensively hydrolyzed formula. So when you're looking at the partially hydrolyzed formula, then what this means, it will just basically formulas that are meant to sort minor digestive problems. Like for example, a child is having colic, a child is having constipation, a child is having a lot abdominal discomfort due to gas. Then for the partially hydrolyzed formula, then that would be the best bet. If you're looking at extensively hydrolyzed formula, then you're looking at a child who is having symptoms relating to cow milk allergy. Okay, this by hydrolyzed we mean the cow milk protein has been broken down into smaller units. The extent of hydrolyzation is what makes it qualify as a partially or extensively hydrolyzed formula. So the extensively hydrolyzed formula is meant for children who are having cow milk allergy. So that's why I said for this group, then you would require a healthcare provider to be able to assist you based on the symptoms that you're experiencing to help choose the best formula. And so in this group, you'll find, based on the brand, then you will find the brand name HA, the brand name Pepti, the brand name Comfort, depending on the company and the brand that you're dealing with. So in this class, you may also find these formulas may have a very different taste from the standard formulas that we talked about, just because of the hydrolyzation process. So you may find some of them have kind of an off taste, or what most people would refer to kind of a bitter taste. You may find some of them are thicker than others, because depending on the hydrolyzation process that has taken place. So number 3, we are looking at the lactose-free formula. The lactose-free formula just basically means the lactose, which is a naturally occurring sugar in milk and dairy, has been removed. So with the lactose-free formula, then it will be ideal if you're having a child who has lactose intolerance. However, we need to note that lactose intolerance is a bit rare in babies. But in case it happens, this is the formula that you would go in terms of choice. This formula can also be used in case you have a child who is having persistent diarrhea, which is impacting on the weight of the child, the growth, the thriving, the development of the child. Then lactose-free formula can also be used in the event you have a child who is having recurrent or persistent diarrhea. Number 4, you have anti-regurgitation formula. So most of the times you will find a brand name and then find AR at the end of the name. So the AR just means anti-regurgitation. This would be ideal for a child where you are having a child who regurgitates milk a lot, who has like recurrent refluxes. So this would be current reflux. This would be an option that you would consider to use. Reason being, this formula has been thickened, and thickening makes it a little bit difficult for a child to be able to regurgitate, hence reducing the chances of the frequency of regurgitation. And also, in case there was reflux, it also helps in controlling or managing the same alongside the medical interventions that might be there. Number 5, you have the anti-diarrhea formula. You'll find it written the brand name and then AD. Just basically meant to help manage or help to be introduced when a child has a bit of diarrhea, and this diarrhea is not long term. Like, for example, the child has been well, maybe was on stage 1, has had some diarrhea for 3-4 days, then you would consider having this form of formula to be used for short term. Okay, the AD is not meant for long term use. That's why I said the lactose free, if it is persistent diarrhea, then the lactose free would be a better option. But if it is not a persistent diarrhea, it's just a one-off that the child is having some issues, or a child is unwell, then you could consider this. Once the diarrhea stops, then you revert back to the formula that you were on prior to the introduction of the AD. Number 6, we have the preterm formula. Preterm formula, or low birth weight formula. So basically means a child who was to be a child who was born before term, and also a child who is also having a low birth weight. These tend to be higher in terms of the nutritional value, in terms of the calories, in terms of the proteins, and many other things may tend to be higher than the standard formula, just basically because it is meant to be used as a catch-up formula, just to help this child catch up faster in terms of weight and in terms of development, by the fact that this child was an underweight baby when being born, or also a preterm baby. Number 7, you have the amino acid based formula. This is a formula that is recommended when you have extensive allergies, because it has been broken down to the smallest unit of a protein, which is the amino acids. So this one will be, or usually we normally say it is the last resort once you have tried all other formulas in terms of allergies and they have failed. So you're having a child with severe failure to thrive and many other medical conditions, then this would be the formula of choice. However, it's not a formula that is commonly used, one, because of even the financial aspect of it, because it is also quite pricey in terms of an amount to purchase. Yeah, so in terms of the amino acid formula, is not a formula that you would use very regularly, and ideally the amino acid based formula should be a prescription based formula. Then number 8, we have the goat milk formula, so which can be You can, as a parent or as a guardian, you can decide, I do not want to use a formula that is cow milk based. So if you would wish to, you can still go for the goat milk formula. However, in case of allergies, and especially cow milk protein allergy, then goat milk is not the formula to go to, because the kind of protein in cow milk and what is in goat milk is very, very similar. So if you're looking at something to help you sort out the cow milk allergy, then goat milk formula will not be what you would go for. So the goat milk formula may be a personal choice, which is allowed. Maybe as an issue of tolerance, probably the child is not tolerating the cow milk allergies very well, but taking goat milk well, but not cow milk protein related kind of allergies. Then you have the plant-based formula. So in case of allergies or in case of intolerances or any other medical issue, plant-based formula can be a choice that you would go for. The most common is the soy milk formula. So depending on the brand, you will find a brand name and soy formula. So this is also an option that you can go for. So I would also like to just repeat and say, most of these special formulas, it would be advisable to, at least before you introduce, have a chat with your pediatrician, your doctor, your nutritionist, to help you be able to ascertain which is the best formula for your baby, because they are usually, most of them are based on medical conditions. So that also, you avoid even wastage, that you tried this formula, didn't work, you tried this one, you tried this one. So you work with a healthcare provider to be able to help you pick the best placed formula based on the symptoms or the medical conditions that your child could be experiencing. Thank you so much for listening, and all the best as you choose the formula of choice.